So, hello students. Yeah. So, hello students. Good evening and welcome to this INI Accelerate Sure Short series. I'll just good evening to all of you. Okay. So, we'll start with this MCQ series. This is an effort taken by the PW team, specially for you. Okay, we'll start with the first MCQ. Have a look at this. Yeah. A 35 years old male complains of severe pain in the abdomen since several days. Gastroscopy revealed an ulcer is seen on the posterior wall of the first part of duodenum. A surgery was planned to repair the ulcer site. During surgery, the hepatogastric ligament is identified. The portal vein is the most posterior structure in this ligament. All the following veins drains into the portal vein except. Yes, any guesses? You answer, let it be an interactive session. Students, you answer whatever you know. All the following veins drain into the portal vein. Yes, any guesses? Answer is C. Yes, answer is C. Answer is renal vein. The renal vein drains into IVC. We all know this. The renal vein, the right and the left renal veins drains into the IVC. Something about the portal vein that we understand. Have a look at this. Some important things about the portal vein. Now, if that's the head, that's the neck, that's the body and tail of the pancreas, and that's the uncinate process here. Now, what is this vein which lies behind the body of the pancreas? The vein which lies behind the body of the pancreas, that's the splenic vein. And the vein which lies over the uncinate process, what is this, students? The superior mesenteric vein. Now, if you understand the structures lying on the uncinate process, this was an MCQ. Structures lying on the uncinate process, who's on the right side and who's on the left side? So we all know structures lying on the uncinate process are the superior mesenteric vessels. So who's on the right side and who's on the left side? How do you remember this? Yes, the vein is on the right and the artery is on the left. Remember students, veins are always on the right side. So that's how we know that the superior mesenteric vein is on the right side on the uncinate process. Clear? Now this superior mesenteric vein lies on the uncinate process, goes behind the neck of the pancreas, right? That's the neck of the pancreas. Here it joins with the splenic vein. And what is this now? That's the portal vein. This becomes the portal vein. And if you can tell me what is this going to be, that's a duodenum. This is the first part, that's the second part, and that's the third part of the duodenum. The portal vein now lies behind the first part of the duodenum. We call this as the retroduodenal part, and this becomes the supraduodenal part of the portal vein, right? So if you get an MCQ stating structures lying behind the neck of the pancreas, what would it be? There are two structures lying behind the neck of the pancreas. One is the superior mesenteric vein, and second one is the portal vein. Remember this, superior mesenteric vein in the lower part and the portal vein in the upper part. So this is what lies behind the neck of the pancreas. Just to enumerate the tributaries of portal vein, students, can you just enumerate the tributaries of portal vein? One, yes, any guesses? One is the left gastric vein. Second one is the right gastric vein, left gastric, right gastric, cystic vein, which comes from the gallbladder, para-umbilical vein, and there's one more, that's the superior pancreatico-duodenal vein. So this becomes the tributaries of portal vein. The left gastric, the right gastric, the cystic vein, the para-umbilical vein, and the superior pancreatico-duodenal vein. Clear? Fine, students. So we'll discuss whatever comes in the way of the MCQs. We'll be discussing everything. Okay, everything pertaining to the MCQs. Okay, just tell me, students, this para-umbilical vein lies in what? The para-umbilical vein is a content of. Can anyone answer this? The paraumbilical vein lies within. Come on, come on, come on. Answer this. There's a fold of peritoneum which extends from the anterior abdominal wall to the liver. What is that known as? The paraumbilical vein lies within this fold of peritoneum. Any guesses? Come on, students. Be quick. Answer. I'm looking at the screen. I'm looking at the screen. Yes, good evening to all of you once again. The paraumbilical veins are the contents of falciform ligament. Yes, it's the falciform ligament. Which is the other content of falciform ligament? The ligamentum teres. Ligamentum teres and the paraumbilical vein. This lies within the falciform ligament. Just remember this, another very important MCQ. Clear? And what is this falciform ligament? No, not median umbilical ligament. No, it's the falciform ligament. Just remember like this, contents of falciform ligament, one is the ligamentum teres and second one is the paraumbilical vein. And this falciform ligament is a fold of peritoneum which extends from the anterior abdominal wall to the liver. Clear, students? Clear to all of you? Okay. Right. So if you can quickly tell me this portal vein, what is this part of the portal vein known as the supraduodenal part? What is this part of the portal vein known as the retroduodenal part? And what is this part of the portal vein known as the infraduodenal part? What are the relations of the supraduodenal part of the portal vein? Another very important MCQ. The MCQs can be formed in any different way. Just remember the concept. So who lies to the right of the portal vein? Any guesses? Can anyone guess this? To the right of the portal vein lies this. What is this? That's the bile duct. Bile duct. And to the left of the portal vein lies an artery here. Any guesses? Any guesses, students? What is the artery which lies to the left of the portal vein? Yes. And all this is present within the lesser omentum. That's the lesser omentum. The lesser omentum which extends from the liver to this lesser curvature of the stomach and encloses a small area of the first part of duodenum. So there are three contents of the lesser omentum: the hepatic artery, the portal vein, and the bile duct. Out of these three, hepatic artery, portal vein, and bile duct, who's the most posterior structure? It's the portal vein. The most posterior is the portal vein. To the right side, remember, how do you remember this? Bile duct. Duct is dextro. So dextro is right. Bile duct is on the right side. Clear? And who's on the left side? The hepatic artery. So understand this relations of the portal vein, the supraduodenal part of the portal vein. Clear? To the right is the bile duct. To the left is the hepatic artery. And who lies behind the portal vein? Any guesses, students? Can anyone guess this? Yes, very good, very good. You are all answering well. There's a big vein who lies behind the portal vein. Any guesses here? A big vein which lies behind the portal vein here. That's the IVC. IVC. And there's a foramen here. There's a foramen here like this. Just try to understand. Okay, what is that foramen between the portal vein and the IVC? What is that foramen known as? Yes, guess this. So, see, you are able to understand many different MCQs that analyze the options. So, behind the portal vein lies a big vein, that's the IVC. And who lies between the portal vein and the IVC? There's a foramen. Yes, that's the epiploic foramen or the foramen of Winslow. Foramen of Winslow, right? Very good, very good. And that's how the relations of epiploic foramen, what is the anterior relation? Yes, anterior relation of epiploic foramen becomes the lesser omentum containing hepatic artery, portal vein, bile duct. Posterior relation is IVC, epiploic foramen. Epiploic foramen. You're understanding? Posterior is IVC, anterior is lesser omentum containing these three structures. But अगर एक आपको select करना है, you have to select only one out of these three who lies immediate anterior. सबसे immediate anterior कौन है? Portal vein. Right. What is the superior boundary of epiploic foramen? Can anyone answer this? Superior boundary of epiploic foramen. Yes, students, guess this. So I'm finishing the epiploic foramen for you. Superior boundary of epiploic foramen is? Yes, any guesses? Come on, bacho, come on. I'm waiting for your answer. Superior boundary of epiploic foramen. Come on, answer. You can guess it. Even if it is wrong, it's okay. Even if it is wrong, it's okay. You guess, you make mistakes here. I'm here to correct you. So the superior boundary of epiploid foramen is formed by the, yes, the caudate lobe of liver. That's a caudate lobe, caudate lobe of liver. And the inferior boundary of epiploid foramen is formed by the first part of duodenum. First part of duodenum. Diaphragm nahi hai bacha, it's the caudate lobe of liver. Caudate lobe. And inferior is the diaphragm. Inferior is the first part of duodenum. I'm so sorry. First part of duodenum. Yes. Very good. So see, I've told you the relations of the supraduodenal part of the portal vein, right? We've discussed the epiploid foramen, also known as the foramen of Winslow. We have understood the relations of the epiploid foramen. Okay? Fine. Very good. Now come to this part. What is this part of the portal vein? It lies behind the first part of the duodenum. क्या बोलते हो इसे? PDF you'll get, bacha. PDF you'll get. Don't worry. So what is this part? The retroduodenal part of the portal vein. Again, students, the retroduodenal part, who lies on the right side? Same, this structure. Who's this? That's the bile duct, है ना? So the retroduodenal part of the portal vein on the right side is the bile duct. Who's on the left side? Students, any guesses? On the left side, ये hepatic artery नहीं होती. Instead of hepatic artery, there's another artery which comes here. I'm just making a different configuration for you to understand. Any guesses? What is this artery? Retroduodenal part of the portal vein. To the right is the bile duct. To the left is an artery. And ये जो artery है ना, what happens? A very important clinical MCQ. Ulcers कहाँ पे होते हैं? Where are the ulcers formed? In the first part of the duodenum. Which wall? Posterior wall. Correct? If there's an ulcer in the posterior wall of the first part of the duodenum, which artery is it going to erode? Come on, बच्चों, which artery is it going to erode? ये पता होगा आपको? Huh? Yes, what is that? The artery is gastroduodenal artery. Very good. It's the gastroduodenal artery. So that's how you understand the relations of the retroduodenal part of the portal vein. ठीक है ना? Right side is the bile duct, left side is the gastroduodenal artery. ये याद रखना. And this is the artery. Inferior pancreaticoduodenal नीचे है. Inferior pancreaticoduodenal is further down. This is the gastroduodenal artery. And this is the artery which is eroded in case of ulcers. Very good, students. Very good. And coming to this part, what is this part of the portal vein? This is the infraduodenal part. So infraduodenal part of the portal vein के आगे कौन है? Who's anterior? The neck of the pancreas. Neck of the pancreas. Correct. And who's behind? Portal vein के पीछे in its entire length is IVC. बस ये याद रखना. Portal vein के पीछे कौन होता है? Who's behind the portal vein? IVC. In all the three parts, there's IVC. Perfect. But what happens to this bile duct? Students, what happens to this bile duct? This bile duct goes behind, yes, which is this part of the pancreas. Can anyone tell me what is that part of the pancreas? Head of the pancreas. So the bile duct goes behind the head of the pancreas and it opens in the second part of duodenum. It goes in the second part of the duodenum. And why is this very important? Another very important clinical MCQ for you students. Which part of the pancreas is more prone to cancer? Yes, which part of the pancreas is more prone to cancer? The head of the pancreas. Barabar hai na? And when there's a CA of the head of the pancreas, who's compressed? Bile duct. Bile duct, what does a person get? Obstructive jaundice. Obstructive jaundice. So जब bile duct compress होता है, obstructive jaundice होता है, CA of the head of the pancreas. बस ये याद रखना बच्चों. Extremely important MCQs. Concept याद रखना, concept. And if you can tell me which part of the pancreas contains the maximum islets of Langerhans. Students, which part of the pancreas contains the maximum islets? बोल सकते हो? Tail of the pancreas. Maximum islets of Langerhans. And this tail of the pancreas lies in which ligament? देखो कितने सारे MCQs are getting cleared बच्चों. Many MCQs gets cleared. Any guesses, students? The tail of the pancreas lies in which ligament? I'll just write it down for you. Tail of pancreas lies in which ligament? Along with splenic artery along with splenic artery. A quick revision, a quick revision for all of you. It lies in, yes, any guesses? It lies in which ligament? It lies in, yes, boliye. Lino-renal ligament. Lino-renal ligament. Lino-renal ligament. Lino-renal ligament. I'll just write it down once again. Lino-renal ligament. So the tail of the pancreas and the splenic artery कहाँ पे होता है? Lino-renal ligament में. And that is why when we are removing the spleen जब निकालते हो, we have to cut these two ligaments, the gastrosplenic and the lino-renal ligament आप cut करोगे. So we have to be very careful when we are cutting the lino-renal ligament, because what does it contain? The tail of the pancreas, and if the tail is gone, the person will get diabetes mellitus. समझ में आ रहा है बच्चों? ठीक है. Now, which is the other ligament of the spleen? Other ligament of the spleen is gastrosplenic ligament. Any guesses? Gastrosplenic. What lies in this? What lies in the gastrosplenic ligament? Come on, students, tell me. What lies in the gastrosplenic ligament? अब कैसे याद रखोगे इसको? How do you remember this? ये जो splenic artery होती है, splenic artery lies in which ligament? Lino-renal, है ना? And जो branches होते हैं ना splenic artery के, the branches of splenic artery, they lie in gastrosplenic ligament. Very easy. Now, which are the branches of splenic artery which goes up to supply the fundus of the stomach? The short gastric vessels, and which is the one which runs along the greater curvature? That's the left gastroepiploic artery. ठीक है? So these are the ligaments of the spleen. Okay, perfect. Come on, students. We've discussed many things here. There's one more ligament of spleen. Any guesses? एक हो गया gastrosplenic, एक हो गया lino-renal ligament. There's a third ligament of the spleen which is actually not related to the spleen. It is not related to the spleen. बस ये spleen को support करता है. It just supports the spleen. It prevents the downward displacement of the spleen. आपने देखा है spleen when it enlarges, the spleen doesn't grow downwards, है ना? ऐसे downwards enlargement नहीं होता. The spleen always grows towards the right iliac fossa. Which is that ligament? Which prevents the downward displacement of spleen? Which is that ligament which prevents, which allows the spleen to grow towards the right iliac fossa? Come on, bachcho, come on. You can guess, you can answer. Any guesses? This ligament is what we call as, phrenicocholic ligament, or this is going to support the spleen. Yes, spleen को support करेगा. It is also known as the substanticulum linus का मतलब spleen, and this is going to support the spleen. This was an MCQ. ये previous PYQ है. This is a previous year MCQ. Some years back it was asked. What is substanticulum linus? That's the phrenicocholic ligament. Why? Because it supports the spleen. Gastrophrenic नहीं है वो phrenicocholic ligament है. Substanticulum linus. I hope this is clear to all of you, बच्चों. Clear? Okay, very good. That completes it. Can anyone tell me what is this vein? Chalo, you must be knowing this, bachcho. You must be knowing this. What is this vein? What is this vein which opens into the inferior mesenteric vein? Come on, fast, bachcho, fast. This is just a quick revision, है ना? ये फटाफट revision है. A quick revision. The more you answer, the more I'll be able to tell you. ये कौन सी vein है बच्चों? Which opens which opens into the splenic vein? I've just told you the answer. That's the inferior mesenteric vein. And this inferior mesenteric vein is a continuation of superior rectal vein. Fine. ये आपको पता होगा, ठीक है? So superior rectal vein continues as inferior mesenteric vein. Inferior mesenteric vein joins with splenic vein. Splenic joins with superior mesenteric vein. अब जो बनेगा portal vein. That's it. So I've explained the entire portal vein for you, children. ठीक है? Okay, fine. We go to the next MCQ. Very clear with all of this? Okay, chalo, we go to the next MCQ. Just have a look at this slide. Have a look at this slide. A beautiful slide. Beautiful slide. What is this? Come on, Ismail, I'll just ask you some things. What is this, students? What is this? Be faster. Be fast and answer. Be fast and answer. What is this structure that I'm pointing? Bacho, come on, students, answer this. What is this structure? That's a falciform ligament. Falciform ligament. Okay. And what is this structure? What is this? That's the left crust of the diaphragm. Just remember this. Visuals can come for you. ये visuals आ सकते हैं. And this visuals can come. What is this? This is the IVC. That's a portal vein. Portal vein. And what is this artery? Sorry. What is this artery? That's a gastroduodenal artery. Gastroduodenal artery. Perfect. Come on, we go to the next MCQ. Students, a visual slide for you. A visual slide. Can you identify this pointed structure? This one. I'll put a star for you. This pointed structure. Any guesses? Any guesses? These are the pyramids. Pyramids. Okay. And how are the pyramids formed? This is the medulla. ये आप क्या देख रहे हो? What are you looking at? That's a brainstem, है ना? What are you looking at? Brainstem. So ये जो cut किया, that's the midbrain. This is the midbrain. That's a pons, and this is the medulla, right? And what is this pointed structure in the medulla? That's the pyramids. And how are the pyramids formed? By the crossing of the corticospinal tracts. Crossing of corticospinal tracts. What is this structure next to the pyramids? What is this structure? Any guesses? A very important visual slide, students. What is this structure? These are the olives. Olives. And how are the olives formed? The olives are formed by a nucleus. अंदर एक nucleus होता है जिसका नाम है inferior olivary nucleus. Inferior olivary nucleus. Students, can you tell me this inferior olivary nucleus sends information to whom? The inferior olivary nucleus sends information to which organ? Come on. Answer. जो आता है वो answer करिए. Whatever you know, you answer. So it will be very easy for you. Look. I'll just make a. So the fibers coming to the cerebellum. Fibers coming to cerebellum are of two types. There are two types of fiber. One is the climbing fiber, and the other one is the mossy fiber. है ना? Climbing fiber, mossy fiber. Where does the climbing fiber come from? The climbing fiber comes from the inferior olivary nucleus. Inferior olivary nucleus. The mossy fibers comes from the cerebral cortex. Cerebral cortex. The spinal cord and vestibular apparatus. Vestibular apparatus. So there are two types of fibers. एक होता है climbing fiber, दूसरा होता है mossy fiber. So where do the climbing fibers come from? Inferior olivary nucleus. Okay, and this climbing fiber will go and stimulate what? Any guesses, students? It stimulates. Yes, any guesses? Purkinje cell. Purkinje cell. It stimulates the Purkinje cell. What do they stimulate? These fibers are going to stimulate the granule cell. Stimulate the granule cell. And this granule cell will further stimulate Purkinje cell. They'll further stimulate the Purkinje cell. ठीक है? So finally, who's to be stimulated? The Purkinje cell. अब एक बार Purkinje cell is stimulated, what does it do? It is the only motor output. Just remember, ये MCQ आया था. Only motor output from the cerebellum. It is the only motor output from the cerebellum And what does it do? It inhibits the deep cerebellar nucleus and lateral vestibular nucleus. Just remember, this is the cerebellar circuit that I've told you, a very important topic. So just once again to recapitulate, the fibers coming to the cerebellum are of two types. One are the climbing fibers, दूसरे होते हैं mossy fibers. Climbing fibers कहाँ से आते हैं? Inferior olivary nucleus. And what do they stimulate? Purkinje cell. The mossy fibers come from three sources: the spinal cord, the cerebral cortex, and the vestibular apparatus. What do they stimulate? The granule cell, which further stimulates the Purkinje cell. Now, once the Purkinje cell is stimulated, that's the only motor output from the cerebellum. And what does it do? It inhibits the deep cerebellar and the lateral vestibular nucleus. ये deep cerebellar nucleus क्या होते हैं? What are these deep cerebellar nucleus? Those four nucleus of the cerebellum. चार nucleus है ना? Nucleus globose, nucleus emboliformis, dentate, and nucleus fastigiae. ये चार nucleus है. These are the deep nucleus, the four nucleus. Okay, clear to all of you? Right. So that's about the olives. And what is this next to olives? यहाँ पे कुछ होता है. What is this next to olives? Next to the olives, here is the inferior cerebellar peduncle. Inferior cerebellar peduncle. So you've got pyramids, you've got olives, and you've got the inferior cerebellar peduncle. Students, can anyone tell me which is the nerve present between the pyramids and the olives? Come on, answer this. Nerve present between the pyramids and the olives. Any guesses? Nerve present between the pyramids and the olives. This you should know. Answer, come on, students. Nerve present between the pyramids and the olives is the 12th nerve, the hypoglossal nerve. And which are the nerves which are present between the olives and the inferior cerebellar peduncle? Any guesses? Nerves present between the olives and the inferior cerebellar peduncle. What is that? That's the 9th, the 10th, and the 11th. The cranial accessory. The 9th, the 10th, and the cranial accessory. Very good. Surgeon, very good. You're answering well. Yes, Vidhi, very good. So nerves present between the pyramids and the olives is the 12th, and the nerves present between the olives and the inferior cerebellar peduncle क्या होते हैं? 9th, 10th, 11th. एक बोल सकते हो बच्चों? Can you tell me this? There's a common nucleus for the 9th, 10th, and the cranial accessory nerve. Can anyone tell me this? There's a common nucleus. A common nucleus of that for the 9th, 10th, and cranial accessory. Yes. Any guesses? What is the name of that nucleus? Any guesses? Come on, be quick. This is just a quick revision, bachon. A quick revision. So there are many things which gets cleared, है ना? A common nucleus for the 9th, 10th, and the cranial accessory is नहीं बच्चा, नहीं. It's not NTS. NTS नहीं है बच्चा. It's not NTS. Anyone else? और कोई guess कर सकता है? Guess करिए. You make mistakes. That's okay. I'm here to correct you. The common nucleus for the 9th, 10th, and the 11th cranial nerves is the nucleus ambiguous. That's nucleus ambiguous, bachcho. Nucleus ambiguous. Very good. And what is this nucleus ambiguous supply? The muscles of the pharyngeal arches. कौन से हैं? 3rd, 4th, and 6th. है ना? Nucleus ambiguous. And this nucleus, आपने बोला nucleus of tractus solitarius, no? Nucleus of tractus solitarius is a common nucleus for which nerves? Come on. See, we have directly jumped where? The nucleus of tractus solitarius is a common nucleus for crazy. Salivatory nahi hai bacha. It's not salivatory. Come on. The nucleus of tractus solitarius. कैसे याद रखोगे? Tongue. Just remember the tongue. हाँ, tongue याद रखना. This you'll understand. Tell me special sensations from anterior 2/3 of the tongue. Who carries? Special sensations, anterior 2/3 of the tongue. 7th nerve, Special sensations posterior one thirds of the tongue. Who carries? Ninth nerve, yes, ninth nerve. And special sensations from the posterior most part of the tongue. Bachcho, special sensations from the posterior most part of the tongue. Who carries? Vagus, vagus, internal laryngeal. That's vagus. बस टंग याद रखिए. Special sensations from the tongue is carried by the 7th, 9th and 10th cranial nerves, and the name of the nucleus is nucleus of tractus solitarius. There will be no mistake, right? Very good, very good, very good, very nice. Chalo, very good. Can anyone tell me what is this junction? ये junction क्या है? What is this junction known as? The pontomedullary junction. है ना, pontomedullary junction. And there are 3 nerves attached here. अब ये एक आप देख रहे हो. This is 1. I'll write A. This is B. And this is C. Who's this? Can anyone tell me what are the 3 nerves attached to the pontomedullary junction? Chorda tympani. That's 7th nerve. Chorda tympani is a branch of 7. Piyush? Yes, very good. Tell me, students, what are the 3 nerves attached to the pontomedullary junction? Come on, come on, come on. It's 6th, 7th, and 8th nerve. 6th, 7th, 8th nerve. This is the 6th nerve, that's the 7th nerve, and that's the 8th nerve. बस ये याद रखना आपको. The motor nerves, जो motor होता है वो सबसे medial होता है. The motor nerves are the most medial nerves and the sensory nerves are the most lateral nerves. बस ये याद रखना. So सबसे motor, the purely motor nerve is 6th, है ना? So it is most medial. And जो purely sensory है, that is 8th. देखो वो सबसे lateral होता है. And जो 7th is 7th nerve, it has got 2 roots. Students, the 7th nerve has got 2 roots. One is the motor root and the other one is the sensory root. है ना, 2 roots होते हैं. एक होता है motor root and the other one is the sensory root of facial nerve. So I've drawn 2 roots. One is black and one is red. So black is the motor root of facial nerve and the red is the sensory root of facial nerve. Can anyone tell me, bacha, can anyone tell me what is the sensory root of facial nerve known as? The sensory root of facial nerve is known as nervus intermedius. Nervus intermedius, or it is known as the nerve of Risberg. Nerve of Risberg. Okay, nervus intermedius or the nerve of Risberg. Right. Very good, very good. Chalo, very nice. We have discussed a lot on this topic. But I mean, I just can't go further if I see the slides and there are so many things that you need to know. If you can tell me, students, there's an artery which lies here. There's an artery which lies here in the pons. Yeah. What's the name of this artery? Any guesses? Any guesses? What's the name of this artery? Okay, no problem, bacha. No problem. No problem. What is the name of this artery which lies in the pons? That's the basilar artery. Yes, very good. That's a basilar artery. And what are these branches of basilar artery? Students? Yes, very good. What are these branches? I'm interested in these branches of basilar artery. These are the pontine branches. Pontine branches, or these are known as the paramedian branches. Paramedian branches of basilar artery. Pontine branches, there's no space only left now. Okay. These are the pontine branches. Pontine or the paramedian branches. Paramedian branches. Can anyone tell me thrombosis of this paramedian branches leads to a syndrome? Chalo, ab bataiye. You tell me. Thrombosis of this paramedian branches of basilar artery leads to which syndrome? So be very clear with your concepts, students. Once the concepts are clear, you'll be able to solve any MCQ. Pontine branches or the paramedian branches of basilar artery, thrombosis of this branches leads to Millard-Gubler syndrome. Millard-Gubler syndrome. Okay, it leads to Millard-Gubler syndrome. Clear? Thrombosis of paramedian branches leads to Millard-Gubler syndrome. बस ये याद रखना. In this Millard-Gupler syndrome, who's involved? अभी देखो, like one thing comes, the other thing has to come. Which nerves are involved? The sixth nerve is involved, the seventh nerve is involved, and the corticospinal tracts are involved. Corticospinal tracts are involved. Okay, so sixth nerve, seventh nerve, and the corticospinal tracts are involved in Millard-Gupler syndrome. Millard-Gupler syndrome. Sixth nerve, seventh nerve, and the corticospinal tracts. So what does the person have? Sixth nerve is gone. Sixth nerve involved है. So what does the person complain of? Lateral rectus है ना. Lateral rectus paralyzed हो गया. तो ipsilateral medial squint. What will the person get? Ipsilateral medial squint. Ipsilateral medial squint. Yes. Seventh nerve is involved. So seventh nerve, it's a lower motor neuron type of paralysis. So ipsilateral paralysis of the face. Ipsilateral paralysis of the face. Entire face is involved and a complete face is involved. So ipsilateral medial squint, ipsilateral paralysis of face along with corticospinal tracts are involved. So there is contralateral hemiplegia, right? So this is the Millard-Gupler syndrome. Millard-Gupler syndrome. Thrombosis of paramedian branches of basilar artery. The sixth nerve, the seventh nerve, and the corticospinal tracts are involved. So lateral rectus paralyzed, ipsilateral medial squint. Seventh nerve is gone, so it's ipsilateral paralysis of the face along with contralateral hemiplegia. Fine, perfect. Come on, answer this. We come to the next MCQ. A 38 years old woman, gravida 2, para 1, at 24 weeks gestation comes to physician for a routine prenatal evaluation. She has no history of major medical illness and takes no medication. Fetal USG shows a cardiac defect resulting from abnormal development of endocardial cushions. This defect is most likely to result in which of the following? Any guesses? Come on, students. Any guesses? So cardiac defects, abnormal development of endocardial cushions. So if the endocardial cushions are not formed, see students, during development of the heart, the first thing to be formed is the endocardial cushions. I'll explain this. And this endocardial cushions, if they are not formed, it results in defective interatrial septum and interventricular septum. Defective ban jate hain. So answer is atrioventricular septal defects. Answer is atrioventricular septal defects. I'll tell you this. मैं बोलता हूँ. See students, understand. Just imagine what is this atrioventricular canal. अब just imagine atrioventricular canal. मतलब who's above this atrium? इसके ऊपर कौन है? Atrium. Who's below this? Ventricles. है ना? इसके नीचे ventricles हो गए. So what is this canal known as? AV canal. In this AV canal, एक septum बनेगा. Look, what is this septum known as? This is known as the AV cushion. AV cushion बनता है. And how is the AV cushion formed? By the proliferation of two walls. एक है ना, this wall will grow downwards and this wall will grow upwards, and ये दोनों fuse होंगे. They'll fuse, and this is what is known as the AV cushion. AV cushion. The first and the foremost is the formation of AV cushion. ठीक है? अब now this AV cushion is formed. Look at this, बच्चों. Look at this. What is this now? That's the AV cushion. हाँ? ये मैंने AV cushion बनाया. This is the atria. Who's below this? Ventricle. इसके नीचे ventricles होता है. Now, what is forming here? That's the interatrial septum. है ना? That's the interatrial septum. Now, can anyone tell me what is this septum which is forming here? This is the septum primum. Septum primum. Now, this septum primum is growing towards the AV cushion. The moment it fuses with the AV cushion, it has to fuse with the AV cushion. अगर ये AV cushion नहीं होगा, if this AV cushion is absent, there'll be a septal primum defect. A septum primum defect होगा. You understanding this? This AV cushion is very important. देखो ये AV cushion है. Now the septum primum will come and it will fuse with this AV cushion. है ना? अब जैसे ये फ्यूज हो गया, द मोमेंट इट फ्यूजेस विद द एवी कुशन, इट ब्रेक्स ऑफ इन बिटवीन, ये बीच में ब्रेक हो जाता है. लुक, आई हैव ड्रॉन दिस, इट ब्रेक्स ऑफ इन बिटवीन. व्हाट इज दिस फोरामेन नोन एज? दिस इज द फोरामेन प्राइमम. ये है फोरामेन प्राइमम. नाउ अनदर सेप्टम स्टार्ट्स टू ग्रो हियर. Sorry, what is this septum which is growing here? That's the septum. I mean, this is the septum secundum, and this septum secundum comes and lies next to this septum primum. And what is this opening now known as? ये क्या बन गया अब? Foramen ovale. That's the foramen ovale. But students, ये foramen ovale कब बनेगा? When will the foramen ovale be formed? When the septum primum first comes and fuses with the AV cushion. If the septum primum does not fuse with the AV cushion, there will be a septal primum defect. You understanding? Now, coming to this interventricular septum. Look at this. Students, look at this. So now that's the ventricle. Interventricular septum is made up of two parts. दो parts होता है. One is the muscular part and the other one is the membranous part. Muscular part and membranous part. Now the muscular part grows in the floor of the ventricular cavity. It just grows on the floor of the ventricular cavity. That's the muscular part. जो membranous part होता है, it is derived from two sources. दो sources से form होता है. One is the bulbar septum, and this bulbar septum is formed in conus. ये conus में form होता है. And this part, ये जो part है ना, this part which is left, who's going to proliferate? The AV cushion is going to proliferate, and the AV cushion is going to fill this gap. So if the AV cushion is not there, there will be a interventricular septal defect. Interventricular septal defect also. Fine, students. So if the AV cushion is not formed, there will be a defective atrial septum and there will be a defective ventricular septum. It will be an interventricular and interatrial septal defects. I hope this is clear. Yes. I'll just write this for you. Membranous, I'll just write this interventricular septum. But see, yaad rakhna, this is very important. Interventricular septum. It is made up of two parts. One is the muscular part and the other one is membranous part. The muscular part grows in the floor of ventricular cavity. The muscular part grows in the floor of the ventricular cavity. The membranous part is derived from, I'm just writing this for you, this is important, derived from one, bulbar septum. And ये bulbar septum बनता कहाँ पे? Where is it formed? In the conus. In the conus. And second is proliferation of AV cushion. Perfect. Perfect. Proliferation of AV cushion. I hope I'm clear to all of you students. Very important MCQs. Okay. Can anyone tell me the rest of the options, bacha? Tell me the rest of the options. Just have a look at this. When do we get this Fallott's tetralogy? Anyone? When do we get this tetralogy of Fallott's tetralogy? When the bulbar septum or the aorticopulmonary septum, we'll make it like this, when the aorticopulmonary septum shifts to the right side. देखो बच्चों, which is the first chamber of the heart? Truncus arteriosus है ना. First chamber क्या होता है? Truncus arteriosus. And in this truncus arteriosus एक septum बनता है. One septum is formed. Name aorticopulmonary septum. And this aorticopulmonary septum divides this truncus arteriosus into two big blood vessels. One is the ascending aorta and the second one is the pulmonary trunk. एक बन गया ascending aorta, दूसरा बन गया pulmonary trunk. Now, normally ये जो है septum, it is formed in the midline. So ascending aorta and pulmonary trunk are of the same size. If this septum is shifted to the right side, if this aorticopulmonary septum goes to the right side, one vessel becomes very small. What is that known as? What is that known as? Pulmonary stenosis, है ना, ये बन गया pulmonary stenosis. So what is the main cause of TOF? The main cause of phallic cytology is pulmonary stenosis. Remember, and ये stenosis कैसे होता है? How does the stenosis occur? Because the septum goes to the right side. So pulmonary stenosis. Because of pulmonary stenosis, the right ventricle contracts, leading to a right ventricular hypertrophy. ये right ventricular hypertrophy हो गया. Then, because of the right ventricular hypertrophy, a continuous pressure, there's an interventricular septal defect. And when there's an interventricular septal defect, what happens? Overriding of aorta. Overriding of aorta. So this becomes the phallic cytology. Clear, students? So aorticopulmonary septum shifts to the right side. Transposition of great vessels is due to improper spiraling of aorticopulmonary septum. Normally what happens is this aorticopulmonary septum is going to turn like this, spiral like this. So this septum is also known as a spiral septum. इसे हम बोलते हैं spiral septum. If the spiraling does not take place properly, normally aorta opens into left ventricle, pulmonary trunk opens into right ventricle. अगर ये spiraling नहीं हुआ, then opposite, reverse occurs. Aorta opens into right, pulmonary trunk opens into left ventricle, and this is what we call as transposition of great vessels. Right? Is this clear to all of you, students? Fine. That's it. That's about the MCQ. Coming to the next MCQ, students. Come on. Okay, bachcho, come on. If you can identify this histological section, histological slide. Any guesses? A very, very important slide and a very specific slide, students. Can anyone guess this? Yes, I'm waiting for your answer. Yes. Come on. This should be spot identification. Identify the histological slide. So, any guesses? Come on. I've not put options for you. You can answer. Whatever you feel, you answer. बोलो. No. What do you think is this? ये क्या लग रहा है आपको? What do you think is this? Does this look like an acinus, students? Does this look like an acinus? Yes, it does look like an acinus. And this is a serous acidus. अब spleen नहीं है बच्चा. अवनी, this is not spleen बच्चा. This is not spleen. Spleen में lymphoid follicles दिखते हैं ना बच्चा. Lymphoid follicles दिखते हैं spleen में. Are you able to see the lymphoid follicles here? No. So this is definitely not spleen. Chalo, any more guesses? You answer. When you make mistakes, no, you will realize it. Salivary gland. Yes. This is an acinus. Okay, this is an acinus. And what is this acinus? This is a serous acinus. है ना? Mucus acinus कैसे दिखता है? Mucus acinus is a very pale staining structure. Pale दिखता है बहुत. It looks pale because the mucus is dissolved during staining. Okay, so this is a serous acinus. And this acinus is a characteristic of what? A salivary gland. So normally we would label this as a serous salivary gland. Okay, we would label this as serous salivary gland, bacha. Example of a serous salivary gland. Any guesses? Serous salivary gland? Parotid. Yes, parotid gland is a serous salivary gland. Example of a mucous salivary gland? Mucus? Sublingual. An example of a mixed salivary gland? It's the submandibular gland. Submandibular. ये सब याद रखिए हैं examples. Fine. So the moment I look at this slide, I feel it's a serous salivary gland. But look, students, I look at this. What do you guess? What do you see this is? Any guesses? What do you feel is this that I pointed? The moment I look at this, my diagnosis is changed completely. It is completely changed. Any guesses, bacha? What is this? I'll clear this so it will be easily seen for you. अब normally आपको लगेगा ये serous salivary gland है, fine, but if I look at this structure, I know it is not a serous salivary gland, but yes, it is something else. जिसमें वो serous acinus भी होते हैं. Serous acinus are there. Any guesses? Come on, बच्चों. These are the islets of Langerhans. Islets of Langerhans है ये. So what do you think is this? Yes, slide of pancreas. This is the pancreas. Okay, this is the pancreas. So pancreas, देखो, pancreas has got two things, no? One is the exocrine part and the other one is the endocrine part, right? One is the exocrine and the other one is the endocrine part. So the exocrine part of the pancreas resembles what? The serous salivary gland. Correct? Exocrine part of the pancreas resembles the serous salivary gland because you get serous acinus, है ना? यहाँ पे serous acinus होता है. So that's a serous salivary gland, and the endocrine part of the pancreas are islets of Langerhans. Fine, bachcho? So this is the slide of a pancreas. Remember this. Come on, answer this. The next one. A 15-year-old male had a history of fall. The surgeon found a hematoma in the anterior compartment of the leg. Which of the following statement best describes about the leg? Yes. Any guesses? Answer this, then I'll tell you the answer. Come on, students. In brief, I'll quickly go through the leg. Then we can see the options here. But can you answer this? Yes? Any guesses? Okay, fine. We'll just discuss the leg first. पहले ये leg discuss कर लेते हैं and then we can go to it. So leg, in a nutshell, I'll tell you. In a nutshell. So just remember this flow charts. It's very easy to remember. Leg has got three compartments. देखिए, just make a chart like this. One is the posterior compartment. One is the anterior compartment. And the other one is the lateral compartment. Posterior, anterior and lateral. Posterior compartment, tell me, which are the muscles? एक होता है superficial muscles. Whatever you know, you tell me. मतलब ना, just try to revise it like this. So it becomes very easy. Superficial muscles कौन है? Gastrocnemius, soleus, and third is plantaris. है ना? Gastrocnemius, soleus and plantaris. इनका common tendon, what is that known as? Tendoachilles. Fine. Now coming to the deep muscles. Deep muscles में one is soleus. I'm so sorry. One is popliteus. What is the action of popliteus? Students, what is the action of popliteus? Unlocking of the knee joint. Unlocking. And who's a locker? बहुत सारे MCQs clear हो जाते हैं. There are plenty of things which gets cleared with a single MCQ. Which is a locker of the knee joint? Quadriceps femoris. Quadriceps femoris is a locker. Unlocker is popliteus. Second, flexor hallucis longus. Third, flexor digitorum longus. Flexor hallucis longus, flexor digitorum longus, popliteus. And fourth is tibialis posterior. Which is the nerve of this compartment? Nerve. Any guesses? The nerve of this compartment is tibial nerve. And which is the artery of this compartment? The posterior tibial artery. This is the easiest way to understand, students. In a nutshell. चलो, posterior compartment का action क्या होता है? Leg. Posterior compartment of the leg does this. What is this? Plantar flexion, है ना? ये क्या होता है? Plantar flexion. And they also do this. What is this? This inversion. Plantar flexion and inversion. The nerve is tibial nerve. Artery is posterior tibial artery. Anterior compartment. Which are the muscles here? Tibialis Anterior, tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius. Peroneus tertius. Just remember this. Tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Students, what is the action of all these muscles? All these muscles, they do what? Dorsiflexion at the ankle joint. Can anyone tell me what is the nerve of this compartment is? Yes, any guesses? The deep peroneal nerve. Deep peroneal nerve, and the artery is anterior tibial artery. Anterior tibial artery. Student, this anterior tibial and posterior tibial are branches of which artery? Any guesses? Anterior and posterior tibial, ये दोनों branches होते हैं popliteal artery के. These are the branches of popliteal artery. Remember, and this popliteal artery is in the popliteal fossa. Popliteal fossa, it gives two branches. So एक है posterior tibial, one is the anterior tibial. So both these arteries are given in the posterior compartment of the leg. Remember, posterior compartment of the leg. What does the anterior tibial artery do then? Anterior tibial artery pierces the intraosseous membrane. Anterior tibial artery pierces the intraosseous membrane and comes to anterior compartment. ठीक है? So anterior tibial artery joint is going to pierce the intraosseous membrane. It is actually present in which compartment? Posterior compartment. Remember. So it is going to pierce the intraosseous membrane and then come to the anterior compartment. What is the action of the muscles of anterior compartment? Dorsiflexion. अब एक last compartment is left, lateral compartment. What is the muscles? Which are the muscles? Peroneus longus and peroneus brevis. Peroneus longus, peroneus brevis. Which is the nerve here? Nerve is the superficial peroneal nerve. Superficial peroneal nerve, and the artery is peroneal artery, which is a branch of posterior tibial. This was an MCQ, students. Peroneal artery is a branch of posterior tibial artery. Just remember this. So what is the action of these muscles of the lateral compartment? What do? They do eversion of the foot. I hope this is clear to all of you. Clear है ना बच्चों? Is this clear to all of you? In a nutshell, I've just told you. ऐसे revise करिए and be very clear with your concepts, students. You'll be able to answer any clinical MCQ then. Shall I answer this? A 15-year-old male had a history of fall. The surgeon found a hematoma in the anterior compartment of the leg. Which of the following statement best describes the leg? See the option B. All the muscles of the anterior compartment are innervated by superficial peroneal nerve. This is wrong. It is innervated by the deep peroneal nerve. The anterior tibial artery arises in the anterior compartment. That's wrong. The anterior tibial artery arises in the posterior compartment. And then how does it go to the anterior compartment? It pierces the intraosseous membrane. Okay. It contains peroneus tertius. That's correct. So anterior compartment, yes, it does contain peroneus tertius. Biceps femoris is inserted on the neck of the fibula. That's wrong. It is inserted on the head of the fibula. Head, not the neck. It is inserted on the head of the fibula, which is the nerve which winds around the neck of the fibula. Students, the common peroneal nerve. The nerve which winds around the neck is the common peroneal nerve. Perfect, students. Perfect. Are you all able to follow? Okay, perfect. Very good. Fine, that's it. See this MCQ. Chalo, we'll proceed to the next MCQ. A 42 years old woman comes to a physician because of right flank pain that started 3 days ago following a procedure. That means there was some procedure done and the patient is now getting a right flank pain. Her vital signs are within normal limits. Physical examination shows right costovertebral tenderness. Costovertebral tenderness. What is the costovertebral angle, students? It's the junction of erector spinae, costovertebral angle. It's the junction of the erector spinae muscle and the 12th rib. Okay, this is the erector spinae muscle and the 12th rib. What is this angle known as? That's the costovertebral angle, and the lower pole of the kidney lies here. The lower pole of the kidney lies here, costovertebral angle. So there's a tenderness there. An IVP shows a dilated renal pelvis and ureter with lack of contrast proximal to the uterovesical junction. The patient most likely underwent which of the following surgeries? Any guesses? Yes, any guesses? So while doing hysterectomy, which is the organ which is damaged? Which is the organ? Yes, yes, yes. Very good. The ureters. The ureters, they go very close to the uterus, right? The ureters. So the answer is hysterectomy. Hysterectomy. Okay, just have a look at this. Tell me, students, what is this view? कहाँ से देख रहे हो? Are you looking it from front or are you looking it from behind? Which is this view? What view was this? This is a view from behind. पीछे से देख रहे हो? Because if you would look from front, you would not see the ovaries. Correct? If you look from front, ovaries will not be seen. The fact that ovaries are seen, this is a view from backside. Backside, right? So that's a view from behind. So that's the cervix here. This is the cervix. This part is the cervix. And what is this structure related to the cervix? That's the ureter. So this ureters are related to the cervix of the uterus. Students, and if you can tell me this, there's an artery like this which is very tortuous, which crosses the ureter like this and enters into the broad ligament. What is that artery which crosses the ureter? That's a uterine artery. Uterine artery. Perfect. Students, can anyone tell me what is this ligament known as? A ligament which extends from the ovary to the cornu of the uterus. From the ovary to the cornu of the uterus. Any guesses? This is the ligament of ovary. And what is this ligament? From the ovary to the lateral pelvic walls. This is the suspensory ligament of ovary. This is also known as the infundibulopelvic ligament. Infundibulopelvic ligament. Okay. Suspensory ligament of ovary or the infundibulopelvic ligament. And what does it carry? Ovarian vessels. Ovarian vessels. It carries the ovarian vessels. Perfect. Okay, very good. Students, very good. Which is a nerve injured during appendectomy? Ilioinguinal. Ilioinguinal nerve. Okay. Fine, students. Going to the next MCQ. Identify this abnormality. Identify this abnormality. A very important visual slide for you. Identify this abnormality. You can see the lower poles of the kidneys are connected to each other. Yes, students. Yes. What is this abnormality known as? The lower poles of the kidneys are connected to each other. What is that? A horseshoe-shaped kidney. And when there's a horseshoe-shaped kidney, this kidney, the ascent of the kidney remains arrested at what level? In other words, it's a horseshoe-shaped kidney remains at what vertebral level? Any guesses? Horseshoe-shaped kidney remains at what vertebral level? Which is that artery? Yeah. You can see this artery here. What is this artery which limits the ascent of the kidney? That's the inferior mesenteric artery. Inferior mesenteric. So horseshoe-shaped kidney remains at what vertebral level? L3. L3. Remember this. A horseshoe-shaped kidney remains at which vertebral level? L3. L3. Okay, perfect. Can anyone tell me this kidney is during development? The some very important MCQs I'll tell you. There are two parts of the kidney. One is the secretory part, and the other one is the collecting part. Secretory part and the collecting part. Can anyone tell me the secretory part of the kidney is derived from what? Come on, students, a very important MCQ. Answer this. Secretory part of the kidney is derived from metanephros. Metanephros. Or it is also known as the metanephric blastema. A very important MCQ, students. The secretory part of the kidney is derived from metanephros or the metanephric blastema. The collecting part of the kidney is derived from ureteric bud. Collecting part of the kidney is derived from ureteric bud. So, इससे क्या बनता है? What is derived from the ureteric bud? It forms the, yes, any guesses? The metanephros forms what? The Bowman's capsule, the PCT, the loop of Henle, and DCT. Loop of Henle and DCT. And what is derived from the ureteric bud? The collecting ducts, collecting tubules, minor calyx, major calyx, pelvis, ureter. Pelvis and ureter. Fine, students. So Bowman's capsule, PCT, loop of Henle, DCT. This is derived from the secretory part, and the collecting part of the kidney is derived from ureteric bud. So what is it going to form? The collecting ducts, the collecting tubules, the minor calyx, the major calyx, the pelvis, and the ureter. Students, if you can tell me, collecting part is derived from a different source. ये अलग बनता है. The secretory part is derived from a different source. Now, these two parts have to communicate with each other. These two parts have to communicate with each other. MCQ failure of communication of collecting and secretory part results in anyone can anyone tell me this? Failure of communication of a very important MCQ, failure of communication of collecting and secretory part results in. Answer the students. You get a visual also. You get small cyst in the kidney, and this is what we call as a congenital polycystic kidney. Congenital polycystic kidney. Okay, remember this, a very important MCQ. If the secretory part and collecting part, they do not communicate, a congenital polycystic kidney. दूसरा MCQ है failure of ureteric bud to form. Failure of ureteric bud to form results in. Any guesses? Results in. मतलब क्या होता है ना? What happens? This ureteric bud goes towards the metanephros. अब ये metanephros को stimulate करेगा. It will now stimulate the metanephros to form the kidney. Right, this ureteric bud will go into the metanephros, and now it stimulates the metanephros to differentiate. If this ureteric bud itself is not there, the kidneys will not be formed. Kidneys banenge hi nahi. And what do you call this as? Renal agenesis. Renal agenesis. Remember this, a very important MCQ. Renal agenesis is due to, yes, failure of ureteric bud to form. And when the kidneys are formed, they are formed in the pelvis. If the lower poles of the kidneys are connected, what do you call them as? क्या बोलते हैं इसको? A congenital, it is known as a horseshoe-shaped kidney. When this horseshoe-shaped kidney ascends up, it is stopped by inferior mesenteric artery. Inferior mesenteric artery. So horseshoe-shaped kidney remains at what vertebral level? L3. That's it. I hope things are clear to all of you students. Come on, answer this MCQ. An easy MCQ for you. A 38-year-old woman undergoes a hemithyroidectomy for treatment of localized, well differentiated papillary thyroid carcinoma. The lesion is removed with clear margins. However, during surgery, a structure lying adjacent to the inferior thyroid artery at the lower pole of thyroid is damaged. The patient is most likely to experience which of the following symptoms? Answer this. This is easy MCQ. So, which is what structure goes with the inferior thyroid artery? That's the recurrent laryngeal nerve. Recurrent laryngeal nerve. Now you answer, students. Now you answer this. Yes, any guesses? It's a recurrent laryngeal nerve. Any guesses? What will the person complain of? Hoarseness of voice. Yes, very good, very good. Yes, Cyan, very good. Avni, very good. Yes, it's the hoarseness of voice. Recurrent laryngeal nerve involvement as a hoarseness of voice, which is the nerve which goes with the superior thyroid artery. Superior thyroid artery. Yes, with the superior thyroid artery goes the external laryngeal nerve. External laryngeal nerve goes with the superior thyroid artery. Students, and if this external laryngeal nerve is injured, what will the person complain of? Answer this. If the external laryngeal nerve is injured, the external laryngeal nerve supplies which muscle? Cricothyroid. Cricothyroid. And what is the action of cricothyroid? It's a tensor of the vocal cords. It's a tensor of the vocal cords. So when the vocal cords are tensed, क्या होता है? You get a pitch to the voice. A high pitched voice होता है. That's because of the tensor action of the vocal cords. And if the external laryngeal nerve is damaged, the tensor action of the vocal cords is lost. The pitch of the voice is lost. Your answer is voice pitch limitation. ठीक है? So when do you get this A? Option A, voice pitch limitation, when the external laryngeal nerve is involved, which is a muscle? Cricothyroid. Cricothyroid. Perfect. Okay. Ineffective cough. Can anyone tell me which is the nerve here? Which is the nerve for cough reflex? बोलो बच्चों. Answer this. एक बहुत common MCQ आता है, like a person is having seafood and the fish goes and enters into the pyriform fossa. The spine of the fish enters the pyriform fossa. Which is the nerve involved? Abhi bolo. Answer this. Which is the nerve supplying the pyriform? Which is the nerve in the pyriform fossa? Which is the nerve which pierces the thyroid membrane? Nerve piercing the thyroid membrane. A very important MCQ. Huh? Vagus, it's a branch of vagus, bacha. It's a branch of vagus. And nerve piercing the thyroid membrane. Now you answer. It's the internal laryngeal nerve. Internal laryngeal nerve. So this internal laryngeal nerve is responsible for the cough reflex. Cough reflex. So if the fish enters into that pyriform fossa, which is the nerve involved, internal laryngeal nerve. Internal laryngeal nerve. What will the person complain of? Ineffective cough. Ineffective cough. ठीक है ना? Clear to all of you? And बच्चों, weakness of shoulder shrug, which is the muscle in helping to shrug the shoulders. The shrugging of shoulders, that's the trapezius. And which is the nerve which supplies the trapezius? That's the spinal accessory. Spinal accessory. Spinal accessory nerve. Clear? So weakness of shoulder shrug is due to the spinal accessory nerve involvement. Is this clear to all of you students? Clear? Okay, perfect. See the next MCQ. Come on students, come on. A visual slide for you. You should be able to answer this. Identify the pointed structure. Come on. I'm just waiting for your answer. Identify the pointed structure. Any guesses? Chalo bachcho, come on. ये कौन सा एरिया है? फर्स्ट है ना, ट्राई टू डिफाइन वेर यू आर, व्हाट आर यू लुकिंग एट, व्हाट इज द स्ट्रक्चर दैट यू लुकिंग एट? ये एक्सिला है, एक्सिला। तो ये ब्रेकियल प्लेक्सस है, एक्सिलरी आर्टरी है। अब बोलो, नाउ यू टेल मी व्हाट इज द स्ट्रक्चर दैट इज पॉइंटेड? आई एम नॉट पुट ऑप्शंस, आई जस्ट वांट द आंसर फ्रॉम यू। दिख रहा है ना, यू कैन सी दैट, नो? व्हाट इज दैट स्ट्रक्चर? lateral cord, lateral cord नहीं है। yes San, very good Amni, it's not lateral cord, it's a branch of lateral cord। अगर मैं यहाँ पे point करता हूँ ना, if I point here, then your answer would have been lateral cord। if I would have pointed here, yes Amni, if I would have pointed here, that would be the lateral cord। so now you are getting the branches of lateral cord। this is the musculocutaneous nerve, musculocutaneous nerve, that's a musculocutaneous nerve, very good। what is this structure? Any guesses? What is this structure? This is the lateral root of median nerve. Lateral root of median nerve. What is this structure? What is this structure? That's a medial root of median nerve. Medial root of median nerve. Any guesses, students? What is this muscle? ये क्या muscle हो सकता है? What is that muscle? This muscle was here. ऐसे था ये, ऐसे था। We have cut this muscle and we have reflected this muscle. It was here. It was here like this. हाँ, अभी बोलो. What is this muscle? Any guesses? Come on, come on, come on, students, come on. A very important visual slide for you. Come on. Yes, that's a pectoralis minor. This is the pectoralis minor. Pectoralis minor divides the axillary artery into three parts। ये आपको पता है ना, you know this। Which is this part? That's the first part। ये muscle के पीछे second part, and what's that? Third part। The first part, second part, and third part, these are the three parts of axillary artery which are divided by pectoralis minor। Clear? What is this structure? Musculocutaneous nerve। This is the axillary vein। Axillary vein। ये ना कुछ points है, ये याद रखना। Some points I'm telling you. Structures lying between, just remember this, structures lying between axillary artery and axillary vein. Structures lying between the axillary artery and the vein. Can anyone tell me this? What are the structures which lie between the axillary artery and the vein? One is the ulnar nerve, and second is the medial cutaneous nerve of forearm. Ulnar nerve and the medial cutaneous nerve forearm. Just remember this, a very important MCQ. Structures lying between the axillary artery and the vein. Structures lying medial to axillary vein. Structure lying medial to the axillary vein is medial cutaneous nerve of arm. Medial cutaneous nerve of arm, which is joined by intercostobrachial nerve. Joined by the intercostobrachial nerve. Another very important MCQ. Just remember this. Whatever points I've told you, students, all points are very important. देखिए, just try to understand this। Okay, so where is the vein here? He's not drawn the vein। I'll make the vein for you। ये देखिए, ये vein है। So what lies between the axillary artery and the vein? There are two structures। One is the ulnar nerve, and the other one is the medial cutaneous nerve of forearm। And which is the nerve which lies medial to the axillary vein? That's a medial cutaneous nerve of arm। Medial cutaneous nerve of arm। ठीक है? Okay, just understand that। See the next MCQ. Come on, students. See the next MCQ. A newborn. Okay, fine. A male newborn is delivered to at term to a 30 years old woman. Pregnancy and delivery were uncomplicated. At birth, the umbilical cord is noted to be large. When the newborn cries, straw-colored fluid leaks from the umbilicus. The external genitals appears normal. Which of the following is most likely cause of this newborn symptom? Yes, answer this. Any guesses? Any guesses, students? Any guesses? Come on, come on, come on. Answer this. Yes. Vitelline duct. सर्जन अवनी वाइटलैंड डक्ट नहीं है बच्चा, वाइटलैंड डक्ट नहीं है ये, दिस नॉट वाइटलैंड डक्ट. एनीवन एल्स? नहीं? Okay, fine, fine. It's not whiteland duct. Look at this. Look at this. One moment. Okay, look at this stuff. This slide. Now tell me, what is this much part? ये क्या होता है? यहाँ से यहाँ तक, यहाँ तक. That's a foregut, है ना? What is this part? Foregut. What is this part? This is the midgut. Midgut. And what is this? Hindgut. That's a hindgut. Now, what is this connection? What is this connection? Can anyone answer this? What is this connection known as? This connection is what we call as the allantois or the urachus. Allantois or urachus. Now, बच्चों, what is this allantois or urachus? देखो, in fetal life, there's a communication between the bladder and the umbilicus. Yeah, na, this is going to form our future urinary bladder, है ना? ये urinary bladder बनेगा. And there's a connection between the urinary bladder, that's the urinary bladder, and that's the umbilicus. ये umbilicus है. So this is the urinary bladder and that's the umbilicus. And what is this communication known as? इसे हम बोलते हैं urachus or allantois. बच्चों, are you following this? So in fetal life, between the bladder and the umbilicus, the communication is known as urachus or the allantois. After birth, this communication is obliterated. ये obliterate हो जाता है. Now this becomes a ligamentous. And this ligament extends from the apex of the bladder to the umbilicus. ये umbilicus है. Umbilicus. From the apex of the bladder to the umbilicus. And what is this ligament? Students, what is this ligament after birth known as? This is the median umbilical ligament. The median umbilical ligament. It extends from the urinary bladder, from the apex of the bladder to the umbilicus. That's the median umbilical ligament. Right, अगर ये obliterate नहीं हुआ, if the urachus or the allantois does not obliterate, the child will be passing urine through the umbilicus. When the child cries, there will be urine coming out through the umbilicus. You understanding this? There will be urine coming out through the umbilicus. And this is what we call as a weeping umbilicus. This is what we call as weeping or crying umbilicus. That's an MCQ, huh? Weeping umbilicus. So weeping or crying umbilicus is due to persistence of urachus or allantois. Ab clear hai bachcho? Is this clear to all of you? So the answer is urachus for this. So when a child cries and fluid comes out through the umbilicus, that means it's a patent urachus or a patent allantois. ठीक है? Right. You are answering vital and duct, no? Have a look at this. In fetal life, the midgut is going to communicate with the umbilicus. देखो बच्चों, the midgut is going to communicate with the umbilicus through. This is what we call as the vitelline duct. ये है vitelline duct. है ना? In fetal life, students, the midgut communicates with the umbilicus through vitelline duct. Right? After birth क्या होता है? After birth, this vitelline duct is obliterated. ये obliterate हो जाता है. So the midgut loses its communication with the umbilicus. The midgut loses its communication with the umbilicus. Suppose students, suppose if this entire midgut remains persistent. Ek minute, I'll just clear this off for you. If this entire midgut remains persistent, the child will be passing feces through the umbilicus. Feces aega na? Yes, feces will come through the umbilicus. And what do we call this as? This is what we call as a fecal fistula. Fecal fistula. So, what is a fecal fistula? It is a persistent vitelline duct, persistent white line duct. If the white line duct remains persistent, that's a fecal fistula. Most of the times, क्या होता है? What happens most of the times? Look, most of the times, one moment. This distal part of the white line duct obliterates. ये obliterate हो जाता है. This much part is obliterated. And the proximal part is left. Look at this. Look at this. The proximal part is left. The persistent proximal part of white line duct is what we call as, yes, students, the persistent proximal part of white line duct is what we call as, any guesses? Meckel's diverticulum. Meckel's diverticulum. So, अगर ये entire white line duct remains persistent, what happens? That's a fecal fistula. Most of the time, क्या होता है? The distal part of the white line duct is obliterated. The proximal part remains, and this is what we call as Meckel's diverticulum. I hope this is clear to all of you students. Is this clear? Okay. So, see the options here. So, failed closure of white line duct remains in fecal fistula. Failed obliteration of allantoic remnants results in weeping umbilicus. Okay. What is medial umbilical ligament? Medial umbilical ligament is the obliterated umbilical artery. Medial umbilical ligament is the obliterated umbilical artery. Just remember this. It's the obliterated umbilical artery. That's the medial umbilical ligament. Median क्या था? Median umbilical ligament is the obliterated urachus. है ना? That's the obliterated urachus. Medial umbilical ligament is the obliterated umbilical artery. Okay, coming to the last option, abnormal fusion of urethral folds. Abnormal fusion of urethral folds. I'll just tell you this. Look, what is the genital swellings form? Genital, okay, swellings. Genital swellings. Genital folds. Or this is also known as urethral folds, and the last one is genital tubercle. All this is derived from mesoderm. Students, so genital tubercle forms what? The genital tubercle forms the penis or the clitoris. Penis or clitoris. The genital folds or the urethral fold forms the scrotum or labia majora. And I'm so sorry. The genital swellings forms the scrotum. Just one moment. I'll just clear this. The genital swellings forms the scrotum or labia majora. Okay, the genital fold forms labia minora, or in females or in males, it's the ventral aspect of penis. Ventral aspect of penis. Clear, students? So look here, once again, this is a very important MCQ. Just remember this. So genital swellings, genital tubercle, genital folds. Genital swellings forms the scrotum or the labia majora. Genital folds is going to form the labia minora and the ventral aspect of the penis. And genital tubercle is going to form the penis or the clitoris. Is this clear to all of you? So, abnormal fusion of urethral folds leads to what? Abnormal fusion of urethral folds. If the urethral folds do not fuse properly, the labia minora would not be formed, or the ventral aspect of the penis is not fused, it's not formed properly. The urethra will open on the ventral aspect of the penis, and what is this known as? Hypospadias. If the urethra opens on the dorsal aspect of the penis, what is that known as? Epispadias. So abnormal fusion of urethral folds, the urethral folds do not fuse, the ventral aspect of the penis is not formed, the urethra opens on the ventral aspect of the penis, and this is what we call as hypospadias. Okay, clear students? Clear with all the options are clear to you? Yes? Are you understanding, following, enjoying? Students, let us proceed to the next MCQ. See here, that's the slide for you. So, ये है genital tubercle. This is the genital folds, and this is the genital swellings. Another very important visual slides. Genital swellings से बनता है scrotum. Now I've just told you, I'm not repeating. Genital swellings, genital folds, and genital tubercle. Perfect. Students, coming to the next MCQ. Come on. A 50 years old man is brought to the emergency department complaining of severe chest pain. His angiogram reveals thrombosis of SVC after the entry of azygous vein. That means thrombosis of SVC after the opening of azygous vein. The condition would most likely cause dilatation of which of the following veins? Any guesses, students? Any guesses? Any guesses? Come on. Any guesses? I'll draw one slide for you. It's a slightly difficult MCQ. Okay, just try to understand this. This is the internal jugular vein. That's a subclavian vein. This is the right brachiocephalic. That's the left brachiocephalic. The left is longer, joins with the right, and forms. This is the SVC. Okay, that's a SVC. Okay, I'll tell you this. And what is this single unpaired vein, students? What is this single unpaired vein? Azygous. That's a azygous vein. Okay, that's a azygous vein. Now, fine. Now look. There's an obstruction. Anyway, before this, can anyone tell me what is this vein? I'll draw another vein for you. This is a vein in front. ये आगे होती है. Azygous vein is backside, no? पीछे है ना? Which is a vein on the anterior aspect of the chest wall. That's the internal thoracic vein. And this internal thoracic vein divides into two branches. Internal thoracic vein. I'll draw it like this. This is the internal thoracic vein. And this internal thoracic vein gives two veins, or it is formed by two veins. One is the superior epigastric, and the other one is the musculophrenic. So internal thoracic vein आगे होती है, azygous vein पीछे होता है. Now can anyone tell me what is this vein? Students, can anyone tell me what is this vein? This is the anterior intercostal vein. What is this vein? That's a posterior intercostal vein. Anterior intercostal vein, posterior intercostal vein. So normally what happens is, this is the anterior intercostal vein, that's the posterior intercostal vein, that's the azygous vein, that's the SVC. Now students, there's an obstruction, there's a thrombosis of the SVC after the opening of azygous vein. यहाँ पे there's a thrombosis here. after the opening of azygous vein. So how will the blood flow? This is a very important MCQ, students. How will the blood flow? Look, the blood cannot go down here. Blood नीचे नहीं जा सकता, so the blood enters into this vein. So the blood, suppose if it goes into this vein, internal thoracic vein, if it goes into the anterior intercostal, posterior intercostal vein, azygous vein, this will not work. No, this is not going to work because obstruction is below the azygous vein. There's thrombosis below the opening of azygous vein. So this is not going to work. This is not going to work. The other option, internal thoracic vein, so the blood will go straight down. What is this vein, students? Superior epigastric. Now this superior epigastric vein, this superior epigastric vein communicates with what? This superior epigastric vein communicates with, just one moment. Superior epigastric vein communicates with inferior epigastric vein. Students, the superior epigastric vein communicates with inferior epigastric vein. Inferior epigastric vein opens into, any guesses? Inferior epigastric vein opens into any guesses? Just one moment. Okay, anyway, I'll just tell you. Internal thoracic vein, the superior epigastric vein. The superior epigastric vein communicates with inferior epigastric vein. The inferior epigastric vein opens into external iliac. External joins with internal to form common iliacs. Common iliacs joins to form the IBC, and finally the right atrium. Right atrium. Okay, I'll just write it for you. Look here. So superior epigastric, then inferior epigastric, inferior epigastric drains into external iliac, common iliacs, IVC, right atrium. Students, clear? So suppose if the blood, there's an obstruction to the SVC below the opening of azygous vein. If there's a thrombosis here, how does the blood go? The blood goes from internal thoracic vein, then superior epigastric, inferior epigastric, external iliac, common iliacs, IVC, right atrium. That's one way of blood flow. Now there's one more way of blood flow. How does the blood? There's another way of blood flow. Look, students, that's the brachiocephalic. Blood upar jayega, upar. That's a brachiocephalic. That's the internal jugular. The blood goes outwards. What's that? Subclavian vein. अगर ये subclavian vein है, you tell me what is this going to be? That's a first rib. If that's a first rib, what is this vein? That's the axillary vein. If that's the axillary vein, what is this muscle, students? This is the pectoralis minor. What is this vein? Can anyone tell me what is this vein which opens into the second part of axillary vein? That's the lateral thoracic vein. And this lateral thoracic vein is directly communicating with a vein of lower limb. What is this vein known as? The superficial epigastric vein. I'll write this for you. And what is this vein known as? This is the thoracoepigastric vein. So how does the blood flow if there's an obstruction to the SVC? I'll just write this down for you. Look at this. Brachiocephalic vein, internal jugular, subclavian, then axillary, lateral thoracic, thoracoepigastric, superficial epigastric. This superficial epigastric vein drains into what? Great saphenous. Great saphenous drains into femoral. Femoral drains into common iliacs. Then common iliacs, IVC, right atrium. Common iliacs, IVC, and right atrium. I hope students, are you following this? So that's how the blood flow, if there's an obstruction to the SVC below the azygous vein, if there's a thrombosis of the SVC below the azygous vein, this is the blood flow. So the blood will be going in the reverse direction. Look here, once again, I'm telling you, have a look, have a look. So the blood, obstruction यहाँ पे the blood goes upwards. So that's a brachiocephalic, that's the internal jugular, here that's the subclavian, that's the axillary, that's the lateral thoracic, that's the thoracoepigastric, the superficial epigastric. Superficial epigastric drains into what? Great saphenous. Great saphenous drains into femoral, external iliac, common iliac, IPC, right atrium. Is this clear to all of you students? A very important MCQ. Fine. So, are you all able to follow this? Any doubts? Prakhar, clear? Okay, we go to the next MCQ. Any doubts anyone has, students? Just tell me. Just one moment. Okay. Answer this. So, what is the answer for this? A 50 years old man is brought. Answer is thoracoepigastric pain. Clear to all of you? Right. See the next MCQ. The image of an embryo. Okay, fine. The image of an embryo at the end of third week is given. Subdivisions of intraembryonic mesoderm are shown here. Identify the area which forms the body cavities. Come on, students. Is anyone able to answer this? Come on. So this is the intraembryonic mesoderm. And this intraembryonic mesoderm, what is this in A? That's the notochord. A is notochord. Yes, any guesses? Intraembryonic mesoderm. Intraembryonic mesoderm divides into three parts. Okay, one is paraxial. The second one is, yes, very good. Second one is intermediate, and the other one is lateral plate. Okay, so paraxial, intermediate, and lateral plate. So lateral plate is the one which is written as D for you. The B is intermediate plate and C is paraxial. In this slide, C is paraxial, B is intermediate plate, and D is lateral plate mesoderm. Students, can you quickly tell me what is the paraxial mesoderm form? Paraxial mesoderm. The paraxial mesoderm forms somites. A very important MCQ, forms somites. What is the intermediate plate mesoderm form? It forms the genitourinary system. And what is the lateral plate mesoderm form? It encloses a cavity. What is that cavity known as? Intraembryonic silo. Intraembryonic coelom. And what is this intraembryonic coelom form, students? This intraembryonic coelom forms all the body cavities. ये जितने भी body cavities होते हैं, the pleural cavity, the peritoneal cavity, and the pericardial cavity, that is derived from the lateral plate mesoderm, intraembryonic coelom. Intraembryonic coelom. Am I clear? So just remember, this is the intraembryonic mesoderm, which gets divided into paraxial, intermediate, and lateral plate. So I've just mentioned this for you. Okay. So answer is D for this. D. Coming to the next MCQ. Come on, students. Come on. A newborn is delivered to at term to a 19-year-old primary gravida woman by spontaneous normal vaginal delivery. The mother had no prenatal care. On examination, the child has a small retracted jaw and hypoplasia of the zygomatic arch. The patient's condition is most likely caused by abnormal development of a structure that also gives rise to which of the following? Yes, any guesses for this? Any guesses for this? So, ye jaw and a mandible, maxilla, these bones are derived from which pharyngeal arch, students? The maxilla, the mandible, these are derived from the first pharyngeal arch. So, there's a problem with the first pharyngeal arch. Which other structure is derived from the first arch in this? The answer is incus. Incus. Answer is C. Thank you, Joshi. Thank you, Ankit. Thank you. So answer is C for this. Answer is incus. So incus is malleus incus, and this is derived from the first pharyngeal arch. The stapes is derived from the second pharyngeal arch. Facial nerve is derived from second pharyngeal arch. Cricothyroid, cricothyroid muscle कौन से arch में होगा ये? Fourth. Fourth है ना? How do you remember this? Which is the nerve which supplies the cricothyroid? External laryngeal nerve. External laryngeal nerve. And this external laryngeal nerve is a branch of superior laryngeal. Superior laryngeal. So answer is C for this. So cricothyroid. Cricothyroid is fourth pharyngeal arch, and hyoid bone, greater corner of hyoid bone, is in the third arch. Third arch. Facial nerve is derived from second arch. Cricothyroid muscle is derived from the fourth arch. The greater corner of the hyoid bone is third arch. The lesser corner of the hyoid bone is in which arch? Lesser corner of the hyoid bone is derived from the second pharyngeal arch. Second pharyngeal. Incus is derived from the first pharyngeal arch. So answer is A for this. A. I'm so sorry. Answer is C for this. C. Clear? Just remember the pharyngeal arches. एक बार derivative of pharyngeal arches देख लो. What all things are derived from which pharyngeal arch? चलो answer this. What is this pointed structure? I've already told you this. मैंने बोला ये आपको. What is this pointed structure? Or what is this cavity that I'm highlighting? ये मैंने क्या highlight किया? Can anyone tell me? Can anyone tell me what is this which I've highlighted for you? Come on, students. I'm waiting for your answer. The thing which is highlighted by me. Yes, any guesses? The thing which is highlighted by me is the lesser sac. It's the lesser sac. So what are the boundaries of the lesser sac? On the left side, this arrow which is pointing is the gastrosplenic ligament. And what is this arrow pointing to? ये क्या होगा? ये this is the linorenal ligament. Gastrosplenic and linorenal ligament. And what is this arrow? This arrow is the epiploid foramen. Very good, Sam. Very good. This arrow is the epiploid foramen. Clear, है ना? So the one which is pointed is the gastrosplenic. You know this now. I'm not repeating. मैं repeat नहीं कर रहा हूँ. Gastrosplenic आपको पता है. Linorenal आपको पता है. What I've pointed, what I've highlighted is the lesser sac. Fine. So ये कौन है? This is the IVC, है ना? This is the IVC. ये epiploid foramen है. The arrow is an epiploid foramen. ये है IVC, and this is the lesomentum. Lesomentum containing the hepatic artery, portal vein, and the bile duct. Hepatic artery, portal vein, and the bile duct. Fine, perfect. Okay, very good. Let us proceed to the next MCQ. Shall I answer this, students? Number 15. A young secretary running back from her office had a glass door swung back on her face. Mr. Glasgow was coming on her face. To protect herself, she held her left hand, which smashed through the glass. On admission to the hospital, she was bleeding profusely from the superficial laceration in front of her wrist. She had sensory loss over the hypothenar eminence and her palmar aspect of medial 1.5 fingers, but normal sensations on back of these fingers over the proximal phalanx. She had difficulty in grasping a piece of paper between her index and the middle fingers. All her long tendons were intact. So, which is the nerve involved? Can anyone tell me which is the nerve involved? Students, which is the nerve involved? Yes, the nerve involved is ulnar nerve. Ulnar nerve. Come on, let us discuss this MCQ. Let us discuss and finish this MCQ. This is the ulnar nerve. And who helps to hold the paper between the fingers? The paper between the fingers. Who holds this? This is adduction of fingers, and this is done by palmar interossei. Adduction of fingers. This is done by palmar interossei. Holding the papers between the hands, between the fingers. So radial artery was cut in front of the flexor retinaculum, and this accounted for profuse bleeding. Yes, so there's profuse bleeding because the glass must have struck the hand. Radial artery is injured. Loss of sensations over 1.5 fingers was caused due to severance of ulnar nerve as it crosses in front of the flexor retinaculum. Correct. Sensations over the dorsal aspect were intact as the dorsal cutaneous branch of ulnar nerve arises proximal. Yes, this is correct. This is also correct. Inability to hold the paper was caused by paralysis of second dorsal interossei. What do you say, students? Is it the dorsal interossei which causes adduction of fingers? No, 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 no. Who does adduction of fingers? That's the palmar interossei. That's the palmar interossei. So this is wrong. Inability to hold the fingers is done by palmar interossei. Okay, that is supplied by deep branch of ulnar nerve. That's correct. But the answer is not dorsal interossei, it's palmar interossei. Clear to all of you, students? Is this clear to all of you? I'll just draw this for you. One moment. I'll just draw this. Have a look. This is very important. Huh? Come on, students, if you can quickly answer this. Sensory nerve supply. Sensory nerve supply. One is dorsal aspect, one is palmar aspect. So this I'm writing as palmar aspect and one I'm writing as dorsal aspect. Chalo, bacho, come on, quickly. We'll just finish this before the time ends. So who supplies the skin over the thenar eminence? That is the palmar cutaneous branch of median nerve. Palmar cutaneous branch of median nerve. Who supplies the skin over the hypothenar eminence? That's the palmar cutaneous branch of ulnar nerve. Palmar cutaneous branch of ulnar nerve. Who supplies this 3.5 fingers here? 3.5 fingers on the palmar aspect. 3.5 fingers on the palmar aspect. Who's going to supply this? Yes, any guesses? That's a median nerve. Median nerve. The same median nerve goes to the dorsal aspect, supplies the distal phalanx of the thumb, distal and middle, distal and middle, and distal and middle half. This is median nerve. Right. So what is the median nerve supply? This is the palmar and that's a dorsal aspect. So median nerve supplies this complete 3.5 fingers, 3.5 fingers here. The same median nerve goes to the dorsal aspect, again supplies 3.5 fingers, but not the proximal phalanx. No, it doesn't supply the proximal phalanx of 3.5 fingers. Here it supplies all the entire 3.5 fingers. It supplies the thumb, the index finger, the middle finger, and half of the ring finger. The same median nerve goes to the dorsal aspect, supplies 3.5 fingers, but not the proximal phalanx. Correct, students? Now you tell me this 1.5 fingers on the palmar aspect, complete 1.5 fingers on the palmar aspect is supplied by whom? The superficial branch of ulnar nerve. Superficial branch of ulnar nerve. The same superficial branch goes to the dorsal aspect, supplies the distal and the middle and distal and middle half. That's a superficial branch of ulnar nerve. Superficial branch of ulnar. Now, see, that means superficial branch of ulnar nerve supplies this 1.5 fingers. The same superficial branch goes to the dorsal aspect, again supplies 1.5 fingers except proximal phalanx. It does not supply the proximal phalanx. That means 3.5 fingers. Look, 3.5 fingers except the proximal phalanx. Who supplies? Median nerve. 1.5 fingers except the proximal phalanx. Who supplies? The superficial branch of ulnar. Now we are left with the dorsum of the hand and proximal phalanges of 5 fingers. Now students, if you can tell me this 2.5 fingers, dorsal aspect of this 2.5 fingers and the dorsum of the hand. This is supplied by whom? This is supplied by the superficial branch of radial nerve. Superficial branch of radial nerve. And this 2.5 fingers, this 2.5 fingers is supplied by whom? This is supplied by the dorsal cutaneous branch of ulnar nerve. The dorsal cutaneous branch of ulnar nerve. I hope this is clear to all of you. This is very important as students. Just remember this. Is everything clear? I'll just type this for you. Is everything clear to all of you? So once again, I'll just brief you. Look, the sensory nerve supply of the hand. The skin over the thenar eminence is supplied by the palmar cutaneous branch of median nerve. The skin over the hypothenar eminence is supplied by palmar cutaneous branch of ulnar nerve. 3.5 fingers on the palmar aspect, median nerve. 1.5 fingers on the palmar aspect, the superficial branch of ulnar nerve. Superficial branch of ulnar nerve. Come to the dorsal aspect. 3.5 fingers except the proximal phalanges. 3.5 fingers except the proximal phalanges, median nerve. 1.5 fingers except the proximal phalanges, superficial branch of ulnar nerve. Now we are left with dorsum and the proximal phalanges of this 5 fingers. So the dorsum and the proximal phalanges of lateral 2.5 fingers, who supplies the superficial branch of radial nerve. And the dorsum and the proximal phalanges of 2.5 fingers on the medial side is supplied by the dorsal cutaneous branch of ulnar nerve. Dorsal cutaneous branch of ulnar. Students, is this clear to all of you? Any doubts? Just get back to me. All these notes will be there for you. All these notes will be given to you. Okay. Okay, students, come on. Quickly, can you identify this? One small, can you identify this pointed structure? Clear to all, clear to all. Sorry. Clear to clear likha maine. Clear to all. What is this pointed structure? Come on, students, we have removed this area. This is the infratemporal fossa that we're looking at. Yes, this is the infratemporal fossa. And which is this nerve that we have pointed? This is the inferior alveolar nerve. That's the inferior alveolar nerve. Inferior alveolar nerve. What is this nerve, students? What is this nerve? That's the lingual nerve. Lingual. Okay, just remember that. Inferior alveolar nerve and that's the lingual nerve. Both are branches of the mandibular nerve. Mandibular nerve. Inferior alveolar nerve and the other one is the lingual nerve. Both are branches of mandibular nerve. What is this muscle which is pointed here? This muscle is the medial pterygoid. Medial pterygoid. The muscle pointed here is medial pterygoid, and what is this artery here? This is the maxillary artery. Maxillary artery. So what is this area which is being focused here? That's the infratemporal fossa. Infratemporal fossa. Clear? And these are the structures which line the infratemporal fossa. Okay, come on, just three MCQs are left. Quickly, we'll just finish this. A 30 years old man with ruptured appendix is brought to the emergency department for surgery. To do an emergency appendectomy, the surgeon has to ligate which of the following arteries? Come on, answer this. You must be knowing this. To remove the appendix, we have to ligate the appendicular artery, and this appendicular artery is a branch of the descending branch of ileocolic. Descending branch of ileocolic. Clear? Appendicular artery is a branch of descending branch of ileocolic. Middle colic and right colic, these are branches of superior mesenteric artery. Left colic is a branch of inferior mesenteric artery. All these are branches of superior mesenteric. The middle colic, the right colic, the ileocolic, these are branches of superior mesenteric artery. Left colic artery is a branch of inferior mesenteric artery. The ileocolic artery gives a branch which is known as the appendicular artery. Appendicular artery. Okay, just identify this slide first. One moment. Just identify this prominence. What is this prominence? This rounded swelling. This is the fourth ventricle. Where are we into? We are in the floor of the fourth ventricle. We are inside the floor of the fourth ventricle. And what is this rounded elevation known as? This is what we call as the facial colliculus. Facial colliculus. And this facial colliculus is formed by the fibers of, yes, this you should know. This facial colliculus is formed by the fibers of facial nerve. It is formed by, facial colliculus is formed by the fibers of facial nerve. Formed by fibers of facial nerve as they wind around abducens nucleus. Fibers of facial nerve, they wind around the abducens nucleus. Okay, so this is the facial colliculus which is found in the floor of the fourth ventricle. And how is it formed? It's formed by the fibers of facial nerve as they wind around the abducens nucleus. Come on, students, answer this. A 30 years old female complains of swelling in the groins. On examination, a small mass is seen protruding in this area. The surgeon diagnoses this as femoral hernia. While considering the femoral sheath and canal, which of the following statement is incorrect? The femoral sheath is continuous with the fascia transversalis. That's correct. So, anterior wall of femoral sheath is formed by what, students? Anterior wall of femoral sheath is formed by fascia transversalis. And the posterior wall is formed by what? Fascia iliaca. The posterior wall is formed by fascia iliaca. Anterior wall is formed by fascia transversalis. The sheath contains femoral nerve. No, the sheath doesn't contain femoral nerve. What are the contents of femoral sheath? The femoral artery and the femoral vein. The nerve is outside the femoral sheath. The femoral canal lies medial within the femoral sheath. Clear? So, femoral artery, femoral vein, and the medial most compartment is the femoral canal. The femoral canal is wider in females. Correct? The femoral canal is wider in females because the pelvis is wider in females and the femoral vessels are smaller, right? The vessels are smaller in size. The femoral vessels are smaller in size and the pelvis is wider. The canal becomes wider in females. Clear? Have a look at this. So that's the femoral sheath, students. Femoral sheath. What is this wall formed by? Fascia transversalis, and the posterior wall is formed by fascia iliaca. Three compartments. This is the lateral compartment. This is the intermediate, and that's the medial compartment. The lateral compartment contains the femoral artery and the femoral branch of the genitofemoral nerve. The intermediate compartment contains femoral vein, and the medial compartment is empty. What is that known as? Femoral canal. And this is the lymph node of Cloquet or Rosenmuller. That's a lymph node of Cloquet or Rosenmuller. And what does this lymph node drain? It drains the glans penis and the glans clitoris. Remember, students, if you get an MCQ stating the penis or the clitoris drains into, your answer, the superficial inguinal lymph nodes. The penis, the clitoris drains into superficial inguinal lymph nodes. The glans penis and the glans clitoris drains into the deep inguinal lymph node. That's the lymph node of Clocket. Lymph node of Clocket. Okay, it drains the glans penis and the glans clitoris. Remember that. And this femoral canal is wider in females. Why? Because the pelvis is wider and the blood vessels are smaller in size. So femoral canal is wider in females. Clear, students? So femoral nerve is not there. Femoral nerve is outside the femoral sheath. One last MCQ, students. Answer this last MCQ. A 50 years old male comes to the clinic with loss of taste sensations. Sensations were not felt on the anterior two-thirds of the tongue. Lesion of facial nerve is suspected. One of the following statement about this nerve is false. Supplies the stapedius muscle. That's correct. The facial nerve supplies the stapedius muscle in the ear. Attached to the brainstem at the pontomedullary junction? Yes, I just told you there are three nerves attached to the brainstem, the 6th, the 7th and the 8th. So there are three nerves attached to the pontomedullary junction. It is a content of the parotid gland? Yes. What are the contents of the parotid gland? Superficial to deep, the facial nerve, the retromandibular vein and the external carotid artery, right? Facial nerve, the retromandibular vein and the external carotid artery. Contains no special visceral afferent fibers. That's wrong. The special visceral afferent supplies the tongue. The special visceral afferent supplies the tongue. And this special visceral afferent is present in which nerves? I just told you, the 7th, the 9th and the 10th nerve. And what is the name of the nucleus? That's the nucleus of tractus solitarius. Correct? So answer is C for this. C. Yes, very good, very good. Contains no special visceral afferent is wrong. The special visceral afferent carries special sensations from the tongue to the nucleus of tractus solitarius. And this special visceral afferent fibers are present in which three nerves? The 7th, the 9th and the 10th nerve. Is this clear, students? So answer is C for this. So students, I hope things are clear to all of you. And this is an attempt made by the PW team to revise the things just before your INI-CET. In case of doubts, do get back to us. I hope you've enjoyed, you've understood, and all your concepts are clear. Believe in your concepts. Once your concepts are clear, you'll be able to answer any MCQ in any clinical way presented to you. Thank you once again to all of you for patient listening. Thank you for your kind attention. All the best to you, my dear children. All the best. Thank you. We'll stop here.